Hey guys, I'm Dr. Jesse Riley. I'm the main therapist and owner of Modern Movement Clinic. And if you're like me, you might be a runner. And what that comes with sometimes is running injuries. I'm here to tell you that you're in good company. Roughly 80% of runners, and I even think that's on the lower side, experience some type of running injury in their career. We know that roughly about 50% of running injuries revolve around the knee. Now there are multiple different factors that are involved with that. That's when you sit down with a good therapist who has experience working with runners to kind of figure out what that is. I can definitely tell you there are sometimes mechanical factors that we have to look at, and that's why you want to find someone who sees how you move and applies that to the running gait cycle. So what I'd like to do is I'd like to show you guys a few things to look for and the ways that we can kind of troubleshoot that to improve your running. Let's go. Pain can kind of come from a couple different angles here. One of the common ones that you guys might know as far as a diagnosis goes is IT band syndrome, right? Usually pain kind of on the lateral portion of the knee. Sometimes we even have it up in the hip area as well. One of the main things that I see with this is when I notice runners in what's called mid stance. So what mid stance is when my foot is already hitting the ground and my body is starting to travel over my foot like so, okay? And what can inevitably happen is I notice that the knee tends to go inwards like so. And I see this on tests like this where I tell the person to drop straight down. And I notice this can occur, okay? And so what can happen with that is we have a couple different terms, one being load. That's just how much stress we're placing on an area, given our distances or volume or intensity of our runs. And then capacity on the other side, how much load can that area tolerate? And so when load is like heavily exceeding capacity, that's when we can get areas like this with pain. And so let's go over a couple different drills we can do to kind of help. So one of the reasons why this can happen is we may have a little bit of limitation in ankle dorsiflexion. Now what that essentially means is when my knee travels over my foot, that's called dorsiflexion, or raising my toe to my shin. And so if we are a little bit limited there, your body takes what was called the path of least resistance, and that might be why your knee tends to dive inwards a little bit, okay? So one way to kind of work on the mobility of the ankle is you can tie a heavy resistance band around your ankle like so. I've got it anchored to some kettlebells. I would probably suggest something a little bit heavier or sturdier. But you want to have your foot quite a bit of ways out here, and sometimes I can put a dowel down that's just on the outside part of my foot, and so the band's pulling me this way, and I'm going to be working on my ankle dorsiflexion as my knee travels forward, kind of towards the outside part of my foot. Okay? You can repeat this. This is a nice little warm-up actually, as far as right before your runs to kind of help warm up those ankles, okay? I would suggest spending, a couple minutes in totality. Let me show you in the front what this looks like. So when I'm saying the knee traveling forward to the outside portion, I'm talking about this right here, okay? Let's go ahead and take a look at the next exercise. So the next thing you guys can be doing is a lot of times the knee is not the one to blame. It's usually the hip or the ankle, and that's kind of why we're focusing on these two areas. So for the next exercise, what we're going to do is we're going to set up into what's called a side bridge position. My knees are going to be bent about 45 degrees. I've got my ankle in line with my hip in line with my shoulder, and this elbow underneath this shoulder here. I'm going to push away. I'm going to stiffen my torso. And it's kind of like I'm getting up out of a chair. I'm going to bring my hips forward and up at the same time. My feet stay together. And I'm going to open and hold this position. Okay? We're not doing clamshells. Clamshells are a pretty useless exercise in the grand scheme of things, especially when it applies to running. But when we add this component here, we're loading this bottom hip and this top hip at the same time. Okay? I'll hold this for about 30 seconds. And then if I really want to add some extra burn, I may just do reps to burn out after, okay? Choose your resistance band accordingly, give it a couple sets, give these things a go, and if we're still not seeing results, come see us and we'll troubleshoot it together.